Welcome to Aspen Ignites, Conversations to Build a Better World, a series from the Aspen Institute that brings together thoughtful people with diverse backgrounds and points of view. Global health work requires innovation and an equity-based approach. That's the topic of this discussion between Lola Adedokun, Executive Director of the Aspen Global Innovators Group, and Blair Palmer at UNICEF USA. They spoke with the Fuller Project contributing writer Maggie Fox.
The first thing we're talking about is innovation. That is a big word. Can we talk about what innovation actually means and how you apply it in your organizations to global health?
So at the Aspen Institute, the way that we are capturing innovation are two ways. One, innovation in technology. Sort of what are the platforms that we can leverage to ensure that people have increased access to care? The second is the innovation and implementation. Sort of how are we changing the ways in which we deliver services so that they are more effective, more efficient, and more accessible, that aren't technology driven, but more about leveraging human capital, social capital, education, to ensure that there's a broader reach for interventions or programs or services that we know work.
When you talk about leveraging a platform,
Yeah.
what's a platform?
All the big words. So we have a fellow who's incredible. His name is Imo Ituk. He's working in Nigeria, and he's using a digital platform to ensure that individuals who are seeking care for their chronic diseases can access this on this online tool. So rather than seeking care through word of mouth, they can actually go to this online platform, say, I'm suffering from hypertension. Who's the best care physician in my community who can address my needs?
That is so interesting. Blair, talk about innovation at UNICEF.
So innovation at UNICEF, again, innovation can be this very broad term, but at UNICEF specifically, we look at new ideas, and it can be a technology, but it can be a product or a process. And for us, I think it's also very important to recognize that it's not always the shiny ball, that is what we want to deliver to our communities. Instead, we're looking for things that are equitable, that we can scale, that are adaptive, and that are also can be used for the communities that we design for and with the communities that we serve. And I also want to say it's very important that we also design things that communities and people want and need. People already have a cell phone. How can you leverage cell phone technology to then be useful to the communities that we're working in? And so it sounds simple, and it can be simple. And so we always say sometimes the best things are these analog type products, right? Where you're, for example, one of the things that we're working on, it's under process of being designed, is a complementary food bowl to teach mothers and children about nutrition. It has slots in the spoon for like how volume of what you need to eat. It tells you like around kind of like where you would put your vegetables, all these different things. It's really cool, but very simple. There's nothing electronic about it or digital, right? But also we work in AI, blockchain, all these other different things that we're trying to apply to low and middle income countries and the communities we work in order to create things that are more effective, efficient, and basically help and show impact.
Let's talk about women and girls. One of the things everybody's interested in is getting women and girls more included in, especially improving global health. They've been left behind, they've been ignored. How can we do that? And can you talk about why it's important to include women and girls more?
We have to emphasize the role of education for women and girls. The fact that if we do not enable them, empower them to engage in determining their own lives by being able to have the agency to make decisions for themselves, we will not be able to meet the goals that the globe has set for the world. So I just want to name that. And secondly, we've seen in our work, and I have a feeling, Blair, you've seen the same, that women and girls are more affected by all of these cataclysmic events and the day-to-day disproportionate delivery of services. So if we aren't engaging women and girls actively from the beginning through their entire life course, we will not make the strides in health advancements that we are setting for ourselves.
I totally agree with you because at UNICEF too, women and girls are part of the journey. We, again, design for and with them. We want them to have agency and voice in their needs. And it could be gender transformative education, as you mentioned. It could also be something as simple as working from a healthcare perspective, right? Making sure that HPV immunization is incorporated in schools, menstrual health kits, those types of things were previously maybe impossible to access for a variety of reasons. And if you don't give the agency and voice to girls, then the world will be left behind. And I do think that they've suffered the most. I'd also be remiss in saying if we didn't recognize the importance of community health workers in this. 70% of community healthcare workers in the world are women. They are the ones that have access to the community. They are accepted by their community. They're able to deliver information that normally maybe people wouldn't even listen to, right? And provide services that otherwise wouldn't exist, and encourage mothers to have their children immunized, encourage caregivers to also make sure that their children are dewormed or even their parents are taken care of. So it's so crucial that we make sure that women, girls, and sort of this labor force of women really have a voice in the work.
And speaking of the labor force, though, I have to name that community health workers are essential, right? And yet we as a health community have not agreed upon how to pay them, support them,
100%.
and weave them into the system so that they can actually thrive. I think we're actually taking advantage of the generosity of spirit that typically is part of being a community health worker.
And the pay gap exists.
Yes.
Anywhere in the world, not just the United States. It exists in all of the places that we're working in. And it's something that I feel like it's a challenge for UNICEF, but it's a challenge for all the implementing agencies on the ground to say, no, we need to value these women and as leaders in their community.
Well, isn't that part of the problem is a lot of this has been considered women's work, right? The work of global health. And it's unpaid work, it's unappreciated work. So does the pandemic give us a chance to do a do-over, right? Start appreciating all these things that health workers do and that women do as their role as unofficial health workers?
I mean, I think what I've seen in my work and working with UNICEF is that any community healthcare worker not only has to be supported in their community, but also by their family. So in a lot of cases, for example, I'm thinking of one community healthcare worker in Yemen. Her husband takes the afternoon off as a taxi driver in order to get her to the remote communities that she needs to serve. They work together in partnership. He's a supportive partner to her because he knows how valuable she is to the community. That's the type of people that are doing these jobs and deserve recognition.
And I'd also add that, I commend a lot of the philanthropic community who have made substantial investments in strengthening the community health worker workforce. What I would say is, on top of that, we have to invest in the systems, the primary health care level system that these health workers typically feed into so that they can have those other resources. If they don't have a supportive husband or they don't have a community around them, then they at least have a system that knows where they are, who they are, and what they are doing to ensure that their community is thriving.
And I think you'd agree with this. It's not consistent across countries, right? So you have ministries of health that put out their remit for what is required, also of what a community healthcare worker's training has to be when you already have a dearth of resources, right? So you don't have resources in clinics, hospitals, never mind like a district clinic in the remotest part of Rwanda, right? And so I think it's also trying to create, back to a system, create a system that works across countries, that's interoperable, to use a technology term, but one where community healthcare workers have pride in their work, they feel appreciated, and it's equitable.
And isn't this something that organizations such as yours can facilitate? For instance, your example of the guy who invented the app, you can use that in a lot of different countries, right? And how do you translate the support, even the idea of a husband supporting his wife to be a global health worker? Is there more that organizations can do to kind of spread that wealth of knowledge?
Well, we're working on re-emphasizing the importance of community resilience. So as Blair noted, asking community leaders, community members, not just healthcare leaders, what they need, and ensuring that there is a space for them to have access to those resources so that they are creating a resilient system, a system of care within their neighborhood that is responsive, that is locally informed and locally designed. We've launched recently the Communities First Global Collaborative in partnership with Partners in Health and the University of Global Health Equity, where we are helping to design, replicate those community sort of neighborhood systems that work better locally, but we're also engaging with academia, with entrepreneurs, with, artists to ensure that there's a holistic system of care so that when we walk into the next pandemic or face some of the current pandemics that we're not even really addressing, like the mental health crisis, that they are ready to address that locally and they're not waiting for a global statement or remit.
And I think also it is the health system strengthening piece, but underlying all of that, and this is maybe the part of global health that, maybe doesn't appeal to most organizations, but has to for someone like UNICEF. Health policy reform in all of this is crucial. If you cannot change what governments and, local districts, anything that you make locally won't work. I mean, it won't. And I think that we, as an agency, as UNICEF, are really looking into, especially post-pandemic, what that means for preparedness, right? So you came out of this, we came out of the pandemic, and I truthfully don't even really think we're still out of the pandemic, right? Because you still are dealing with other pandemics, cholera, for example. And so the preparedness efforts have to be holistic. You have to have a health system strengthening piece, but then also, again, to Lola's point, make sure that the education systems are still there and that the infrastructure exists so that you're not leaving girls behind, you're not leaving children behind, you're not leaving the most vulnerable behind.
And this is a huge question. How do you get governments to want to do this? Because, right, that's a long-term goal, and governments have short-term goals.
I would say actually governments do want to do this, but there are barriers that are out of their control. So we'll talk about the sort of global health financing system. When you think about how decisions are made and how financing vehicles are designed, they're designed outside of country. And country leaders have to figure out a way to make them work. Typically, they're siloed, they're vertical responses, meaning there's an HIV response or a cholera response. And there's no flexibility for a health system leader, even at the highest level, to say, let's strengthen the primary system and use all of these resources in a way that works for us. They actually they're stuck within these vertical financing platforms that really constrict their ability to be responsive and flexible.
I think at UNICEF too, part of our, convening power is the fact that we do have an audience with governments and that we can go to them and say, this is how we can work together better. And it's not about completely shifting everything all the time. It's usually about how can you adapt something to make it more cost-effective, efficient, and impactful.
Right.
But all of that's really nice. But if you don't have a way to sustain the programs, so going back to this global financing facility for global health work, I think doing it in the right way and having the sustainable funding to have it go beyond, say, pandemic response is key. And governments have to also sign up for that.
Right.
And that's a challenge sometimes. And it's easier in some places in the world than others.
And that brings us to the question of partnerships and working together. And the United Nations sets these sustainable development goals, which are benchmarks to work towards. But how can your organizations work together? Can you give us some examples of partnerships that have worked and how you can do more of that?
I'll have two great examples. One, in the pandemic, we had 3 fellows who are based in Kenya primarily. They were across 3 different fellowship cohorts, but they were thinking about how to create an epidemiological system, a way of collecting data so that the government could respond more quickly to the pandemic. These were leaders who were actually sitting over dinner, just chatting, and they knew that they had a shared goal. How can we strengthen our system? And they brought in a research, policy, and practitioner perspective and designed something called the Center for Epidemiological Modeling Agency. this group now is not only responding to the pandemic, but is actually a connected tissue to the government, so that when there is a new issue area, they have these systems in place to collect data. The reason it happened was because they had the space to just share ideas with one another. It is sad to say that it's a privilege, especially in our systems, that we can have protected time and allow leaders to have protected time to share ideas and to ideate and design things that work best for them. So I would just note that when we think about systems transformation and strengthening, when it comes to financing, giving the flexibility for leaders to think and reflect, and then putting them in spaces where they have other thinkers, and then investing in catalytic funding so that they can test their new ideas it's not a want to have anymore. It's a must have.
We just had a conversation this week about exactly that, catalytic philanthropy for preparedness. And while all of these SDGs, the Sustainable Development Goals, all 17 of them, we're working towards something, right? But if you don't have the means and the ability, as Lola said, and flexibility to be able to implement funding in ways that you need for your core resources. I say that at UNICEF, core resources are key, because just because a pandemic happens, and yes, we need to get vaccines into arms, there's also conflict still going on in the world. There's child protection issues. There's children not in schools. There's kids that need basic immunization. So essential services still have to operate amongst all of the other crises in the world. And that's one of the challenges, I think, of achieving the SDGs, right? So 2030 is the goal, right? And we're very behind. And I think that most people would admit that. And if the pace doesn't increase of how we're responding to things, we as UNICEF, we as other UN agencies, the Aspen Institute, other people that are involved in this work, we won't achieve all of them. There's 17. There's like 125 indicators, right, for measurement. Now, measurement's really important. But just as the previous goals were called the Millennium Development Goals, we realized we had to make a shift. Yeah. And that's what the SDGs then aim to do. Yeah. But there's a lot of work to be done, and it will never stop. And so I think that that's, from a partnership standpoint, we have to do everything in partnership. If you don't have collaboration, you will not get anything done. And I feel like working in silos is also what's hindered progress on the SDGs.
Right. And I think we have an extra special privilege in being able to bring the brightest minds from the highest levels of aid to some of the brightest minds from the local level together in the same spaces. And the more that we can do that effectively, the more that UNICEF and Aspen and so many other groups who are informing the policy agenda, informing the research agendas, and informing the systems designs, the more we can come together and agree and, again, give the latitude for, I wouldn't say failure, but for learning and documenting learning that can be shared more readily to systems leaders, the better off we will be, and the faster I think we can sort of meet these goals.
The localization context, I completely agree, is probably one of the most important pieces of this whole puzzle. Right. We'll never solve all of these SDGs if it's not done for and with and in the communities that we work in, with champions of people that want to sustain change. Yeah.
Well, it sounds to me like you both have plenty of examples of people who know how to solve these problems. If they can just share their ideas more broadly, help them develop their ideas.
That's what we're here for. We're going to try.
Yeah, we are.
And together, we're very excited about working more with the Aspen Institute, especially in the Women and Girls Forum, and how we can give agency and voice to youth and women worldwide.
What a pleasure speaking with you both. Thank you so much for sharing your ideas.
Thank you so much.
Thank you for having us.